Hello everyone, my name is Dr. Siddharth Bajaj. I'm an interventional cardiologist from Russh Hospital, Suchitra. Today, let us understand the difference between CT coronary angiogram and a conventional coronary angiogram, the two tests that help detect blockages in the heart arteries. So, first of all, what is a CT coronary angiogram? It is basically a non-invasive test. A dye is injected into the vein in your arm and a special CT scan is done which takes a detailed picture of your heart and the arteries in your heart. It is fast, it is painless, and it is usually done as an outpatient procedure. But when is it indicated? It is indicated in patients with low to intermediate risk. Young patients whose chest pain is very atypical, does not look like from the heart, may or may not be from the heart. In that case, to rule out, we must get a CT coronary angiogram to be on the safe side. So what is a conventional coronary angiogram? A conventional coronary angiogram is done in patients with a high risk, with a high suspicion. Patients over the age of 50 years, patients who have diabetes, patients with a family history of heart disease, or patients with poor cholesterol coming to us with heaviness in the chest or chest pain. In that case, with a high suspicion, we must get a conventional angiogram. A conventional coronary angiogram is done by a cardiologist. It is done in the cath lab where we send a straw-like tube from the wrist or from the leg. We go to the heart and we inject a medicine, a dye, so that we can see it clearly on what is known as an X-ray tube known as fluoroscopy. So on fluoroscopy, we get a very clear view. So now what is the difference between a CT coronary angiogram and a conventional angiogram here? A CT angiogram is only 90 to 95% correct to detect blockages, whereas a conventional angiogram is 100%. It is the gold standard for detecting any blockages in the heart. And the advantage of it is that when we are doing an angiogram with high suspicion, if we see any blockages, we can open it right there and then. That way, we can even save a patient's life. So a patient who has changes on the ECG, we go ahead with an angiogram, we see the blockages, and if it is a serious blockage, we open it on the table. So if you are young, with a low suspicion of heart disease, but with chest pain, in that case, you must get a CT angiogram done. It uses more contrast, but it is less invasive and it is less painful and it can be done in a very short while. Whereas an angiogram uses less contrast, less medicine, but it is 100% confirmatory, and we can, in one setting, we can remove your blockages along with the angiogram in a procedure known as an angioplasty. Henceforth, if you have any suspicion, please get an angiogram, but with low suspicion, we would prefer a CT angiogram. Please come to Russh Hospital where I am available. You can contact us anytime. We have 24/7 cardiology services. Please take care of your health. Thank you.